Hey folks, it's Carl at Sterling Health and Fitness and hoonshealthy.com. Thanks for tuning in. So today I have a special guest with me, returning again to our program. She is a podiatrist and human movement specialist here in New York City. She's also the founder of the Evidence-Based Fitness Academy. I'd like to introduce, joining us again, Dr. Emily Splichal.
Thank you very much.
Thank you. Always great to see you.
Good.
And always learn all this great stuff from you. So, you know, you have a lot going on with EBFA, Evidence-Based Fitness Academy. And what I wanted to ask you is, is there a particular underlying concept for all the different certifications you offer? So if I remember correctly, there are 3?
Yep.
Okay.
Yep. So we have 3 certifications. BEAR is our workout that taps into or targets the group fitness instructor. We have barefoot training specialist, which would be for the fitness professional as well as the coaches, strength coaches. And then we have Barefoot RX, which is a little bit more of a medical spin. So we get a lot of physical therapists, chiropractors, podiatrists, massage therapists, etc. that take that certification. All of our certifications, regardless of who we're targeting, the underlying theme is what we call from the ground up. And that from the ground up is how we stabilize our body, obviously from the ground up. So it's using the foot as a kinematic structure, meaning the joints and how is the subtalar joint coupling with different things. But it's also looking at it as a neuromuscular structure, so that would be the barefoot. So what is it about the skin on the bottom of the foot that taps into how your body stabilizes?
Right.
That's the first underlying theme. And then we build upon that what we call from the ground up efficiency. So how is your body loading and unloading with every step that we take from a neuromuscular perspective?
Okay, great. Actually, I took the barefoot rehab course a couple of months ago, and it was actually just so awesome. Like I've told pretty much everybody, at least in my industry anyways, that and the CES through NASM are the 2 best tools I have in my toolbox. And they complement each other very well. So I remember a story you were talking about, something, I think it might have been some dancers, I don't know where, but they had a new floor that had been built, and after this new floor was built and they were doing their routine on it, their injury rates went up. And I think you were discussing about something about a pre-activation theory.
Yep.
Can you explain that to me?
Sure.
I'd love our listeners to hear about pre-activation.
Sure. So the foundation of what we teach is based on understanding how your body actually reacts to load or impact. So let's say we're walking, we're jumping, you know, we're a runner, dancer, it doesn't matter, and you have that repetitive impact with the ground. So you have these ground reaction forces that are coming in. A lot of people will relate different injuries as like an overuse injury from the impact. Where there's actually a lot of controversy around this.
Right.
And it's like, how is our body really reacting to the impact? How does our body perceive impact? So at EBFA, very dedicated to changing the way that we look at impact. Our body perceives impact as vibration.
Right. And
the way that our body damps those vibrations. So your body doesn't like to vibrate, right? So the way that it damps those vibrations as they're coming in is by contracting, and we contract isometrically. So, but you want to not react to the impact forces, you actually want to react before you even encounter those impact forces.
Right, okay.
So that's
It's
where...
like before the foot hits,
before
you want to have the reaction occurring already.
Yes.
Pre-activation.
Yes.
Okay.
So I often tell people that the most efficient way, or the way to be the most efficient, is to be anticipating or reacting before you even encounter whatever you have to correct to, so those impact forces. So that's where the theory of pre-activation responses comes in, and the accuracy of those pre-activation responses dictates your injury risk. Okay, so if we go back to the story that you're talking about,
right.
Actually, let me say first that after just 3 steps, your body already knows the amount of impact coming in.
Okay.
Remember, impact is vibrations.
Right, right.
So after 3 or 4 steps, your body already knows the frequency of those vibrations coming in.
Okay.
So by the 3rd or 4th step, before your foot even contacts the ground, the muscles are contracting isometrically to the specific frequency of what's coming in.
Right, okay.
Follow me?
Yeah, I do. It's fascinating.
Okay, so with dancers, specifically, if they're doing a jump, jumps have 10 times their body weight in impact forces, which means the frequency is going to be much higher and of a different amplitude. So they anticipate that very accurately, and that's how they don't get hurt. So the story was based on, it was a story in Dr. Nate's book, which is Biomechanics of Footwear or Sports Shoes, something like that.
Okay.
And he was called by Cirque du Soleil, and Cirque du Soleil had this new stage, has a very, very low injury rate in Cirque du Soleil,
Right.
but they got a new stage.
Okay.
And all of a sudden, they started getting injuries, and they were like, well, our dancers don't get injured. So Dr.
I remember that.
Mead-
He was saying
yeah,
they don't get
injured because they're anticipating
Right.
the amount of vibrations that are coming in when they land.
Right.
So they flew Dr. Mead in, Dr. Mead went, and he looked at the stage, and underneath the stage there were beams so many feet.
Right.
So now, wherever there was a beam, there's going to be a different vibration
Okay.
than where there's no beam.
It may not be as forgiving where the beam is, obviously.
Correct.
In between the beams, they
Correct. So if the dancer is anticipating a certain frequency when they contact the ground and it's off, that throws off your soft tissue network. So it starts to shift. It goes into your tendons. This is where we get tendinitis. It goes into the bones. So Dr. Nick was like, listen, you got to have one consistent surface so that as these dancers land, the frequency is guaranteed going to match what they're anticipating. So they changed the surface. It was all one frequency the entire way. All the injuries went away. So it is amazing. And if you look at injuries that way, runners, 70 to 80% of runners get injured, and that they're overuse injuries. The way that I treat those in my office is I look at the pre-activation responses of my patients. And if they're not getting a consistent input of the amount of vibrations coming in, it's going to be off.
Right.
They will get hurt.
Yeah, right.
So that's where barefoot science comes in, is because the most accurate perception of the vibrations coming in is when you have nothing on your foot. No sock, no shoes, no minimal shoe, no cushion, no orthotic. You need to have that barefoot, and then you will have the most accurate perception of vibrations coming in. Then you can anticipate the impact forces.
Okay. So these dancers are barefoot, correct?
Yes.
And of course, the skin on the bottom of the foot is so important to we're stimulating our nervous system. So I can see where if the impact forces are different, or the surface is different, let's say,
Yep.
and you're anticipating the old, you take one step on this surface, and then all of a sudden you have something less forgiving. Boom! I mean, you can get injured.
Yeah, you need to have that consistent, accurate input for your body to get a response. So it's usually after like 3 or 4 steps. So it's pretty fast that your body will respond. And yes, it is through barefoot. Even shoes, the cushion in the shoes damps the vibration, which you don't want.
Right.
If the shoe is damping some of the vibration, it's not going to match the frequency of what your lower extremity is doing, such as the calves. So that's where all of the pre-activation training that I do with patients and with athletes is done barefoot. We want to tap into the skin in the bottom of the foot.
Okay.
The small nerves in the bottom of the foot are specific to vibration.
All right. Great. Well, actually, as I think about this, you have a lot going on. You're always developing new programs, different things. So how does all of this tie in with what EVFA has you lined up for 2015?
Yes. So 2015, very excited because we have new content. So I call it a little like facelift for all of our courses.
Awesome.
Or it holds true to the concept that we're evidence-based. So Evidence-Based Fitness Academy, I want to always add in and keep the latest research in all of our courses. So pre-activation training, we're expanding on this. We're going a little bit more into vibrations, so things of how fast are these pre-activation responses happening. There's what's called a vibratory reflex that is happening. Which muscles, right? Is it fast twitch? Is it slow twitch?
Okay.
Right? So kind of exploring that a little bit more, as well as nerve distribution. So it's a lot of information. We're adding in what's called muscle tuning.
Mm-hmm.
Muscle tuning is the concept developed by Dr. Nig, and it's looking at how our muscles contract isometrically.
Okay.
And a lot of people, when I first introduced this concept, kind of fight it because we're taught eccentric into concentric. Eccentric is how we decelerate. Eccentric is how we load. And I even say that in my classes.
Right.
But then I'm
that.
a little like, okay, we're going to say that eccentric is the loading.
Right.
But really it's isometric.
Mm-hmm.
Muscle tuning is isometric. Isometric is to damp the vibration so that pre-activation ties in with the muscle tuning and the isometric contractions. Third thing that we're adding in, which isn't necessarily related to that, but it has to do with the aging foot and our peripheral nerve health and how we stimulate it. Think of like, I call it barefoot baby boomers, because I want everyone past a certain age, and I think everybody from
I'm at the tail end of the baby
boomers to baby boomers should be doing barefoot stimulation, not from like let's get the way that we were designed to move, but understanding that if you don't use it, you lose it. If you don't challenge your peripheral nerves and the small nerves on the bottom of the foot, you will lose them. They will start to age, they will start to deteriorate. Our vibratory sense peaks at age 40.
Okay.
As soon as you're 70, you require twice the amount of stimuli to create the same response.
Wow.
And then you put shoes on top of that, so now you need even more. So it's looking at the fall risk. So as we age, the fall risk is huge. It's a huge public health concern.
It is, yeah.
And all of the programming, all fall reduction programming right now focuses on, yes, balance and all of that, but there's not an undertone of barefoot stimulation. Like, let's take all of this barefoot science, how your body controls center of gravity and dynamic stability, and tie it into fall reduction. That's huge. So that's a big part of what we want to focus on.
Especially with the growing baby boomer population. Mm-hmm. I mean, we have, I don't know if we're there yet, but I know at some point that part of the population is going to be, well, it's a huge part right now,
like
but it's going to get even bigger, especially in the next 10, 20 years, as far as being an elderly population.
Yep.
So, and we're already seeing a lot of issues, besides the normal issues you hear about everywhere, things like these come up, stability, balance, nerve degeneration. So that's really, this is great stuff.
Yeah.
So 2015 is going to be a real interesting year.
Yep. I was going to say that my won't about the vibrations and how we actually build bone density. So it's, if you can get more vibrations coming into your body, which means get away from the shoes, the vibration frequency of impact forces matches the frequency that you need to increase bone density. Okay. So not only from a fall reduction perspective, but from a osteoporosis bone health perspective, barefoot training is really powerful. That's mine.
That's great.
My PSA.
You're the expert on this too. I mean, this is really important information. It's one of my mission. Part of my mission is to get this stuff out there. You know, like I said, I took the barefoot rehab certification workshop and took the test and all that. So this stuff is powerful information. You know, and I have been implementing it with clients now, and a couple of runners who are seeing a difference now. So it's really exciting.
Yeah.
And well, this is great. So, anything else you want to talk about or mention before we sign off here? Your website, well, you have a couple different things. One of them I have on the top of my head is ebfafitness.com, which the link will be on the screen. You have a blog also. Yep,
barefootstrongblog.com. I talk a lot about the vibration training, pre-activation, barefoot baby boomers. All of these concepts are available on the blog.
Great. And of course, we have the Barefoot Training Summit coming up, which I'll have a link from here going to that video. Because that's going to be epic, 2015 Barefoot Summit. So, well, good. Well, thank you so much. This has been great. Always learn so much when we're together.
Good. You are so welcome.
You got my brain thinking here all the time. It's great. So, thanks again.
Oh, you're so welcome.
Thank you, folks. Thanks for tuning in. Be sure to check out the blog, the website, boonsofhealthy.com. You can watch other interviews we've done and a whole bunch of other stuff too. So thanks for tuning in, folks. Have a great day.